Hello, everyone. I'm happy to be here. And as Holly said, before I started working at the WHO, I was working in Chile as a cochlear implant surgeon. That was not so long ago, just August. So I really understand how relevant it is to have access to cochlear implants, but it's not that easy. We need to consider cochlear implants in the context of ear and hearing care, not as something alone. So let's talk about how can we make cochlear implants affordable and accessible from a public health approach. Next, please. Okay, first, the facts. 430 million people experience disabling levels of hearing loss nowadays. And that's the third large cause of years living with disability globally. So it's a very big problem we need to deal with. Next, please. So, and unfortunately, hearing loss is on the rise. We expect for 2015 more than 700 million people with disabling hearing loss. Next, please. These, they're not only facts, we have the gaps. Over 80% of persons with hearing loss don't have access to the care they need, and the cost of that is $1 trillion annually. Next, please. Talking about gaps, this is a big one. One of the reasons of the lack of access to care is the insufficient and unequal distribution of ear and hearing care specialists. And you can imagine that this is even more relevant in low and middle income settings. But let's be positive. Some good news here. Next, please. We know that ear and hearing care, hearing health across the life course is possible through prevention, early identification, care, and rehabilitation. So we have the tools to solve this. Next, please. Another good news is that over 60% of ear and hearing conditions can be addressed at primary level. So, of course, we need to focus the resources in primary and community level, knowing that we can solve 60% of the needs of people. Next, please. Something very good to know if you have the possibility to talk with a policymaker or a politician. $16 is the anticipated return of every dollar invested into ear and hearing care. So it's a great investment in countries for the society. But then what do we need to do? What to do? Where to start? Next, please. First, as Sarah exposed very clearly, advocacy is very important. Advocacy and awareness. And I love this tool. This is the World Report on Hearing. This tool compiles all the information you need to understand the ear and hearing care global situation, and also the plan of how to start or continue growing an ear and hearing care program in a country. So it's a very relevant publication, cited and presented in different places. We also have executive summary for policymakers and decision makers. And if you don't know it yet, please check it out. It's in WHO website, and it's something you really need to review. Next, please. Another way to go are campaigns. For example, for us, World Hearing Day. Every 3 of March is World Hearing Day. Next, please. And we have more than 800 events in more than 100 countries every year. WHO provides a theme and materials to support the activities that every organization, country, group develop. And next, please. For this year, we had a very, very strong theme. The theme was changing mindsets. This theme is so relevant for access. Mindsets, wrong mindsets are a limitation for people with hearing loss to access the services they need. So I have to say that we need to continue working on changing mindsets. This is a very, very important issue. Another way to go are technical tools. We develop epidemiological and public health technical tools to compile data. We have tools for training of human resources. We have screening program tools. We have a handbook to guide screening through the live course. And also here, the app. I suggest you can download it from Android or Apple. So if you don't have it, do it and try it for screening. But when we talk about access to devices and rehabilitation, and you need to think from a public health point of view, where do you start? So let's see, next please, what's happening? Well, we know that 94% of people with hearing loss can be helped with hearing aids. So of course, the rationale is there, and we started, next please, addressing access to hearing aids. And for that, we have two tools. One, the preferred profile of hearing aids. But you know, in low and middle income settings, we all heard about over-the-counter hearing aids, etc. But in low and middle income settings, that's not the way to go. You need to provide the services along with the devices. So next, please. So we developed, let me see, exactly, the hearing aid service delivery approaches for low and middle income settings. I want you to think about cochlear implants during the time I am explaining to you this tool. So what's the objective of this tool? To provide hearing aid at community level based on the task sharing concept. That means the hearing aids are fitted by trained non-specialists. This tool provides two approaches, one for adults and one for children older than 5 years old, and have been already field tested in 3 countries. Next, please. Why is it good to count with this kind of tools? Because they provide availability of evidence-based field-tested approaches. So you already have there the tool, you don't need to create your own. Availability of information materials to facilitate the use of hearing aids in this case, and the barriers are already documented since the tool had been field tested in different settings. So who is the target audience for this? Well, first of all, member states, and in member states, decision makers, NGOs that work with the ear and hearing care, and of course, manufacturers and innovators. Next, please. The key points. We want to narrow the gap of access to care. That's the first one. Can we go to the slide before, please? 1 second. Excellent. Thank you. Second, we look for low cost, but high quality, not losing the quality. And third, this should be able to be adapted to different socio-cultural realities. Next, please. Well, these beautiful photos are from the field testing in South Africa. And I had the pleasure to see how a trained community worker was able to go from assessment to fitting in this nice lady in 1.5 hours. So I'm very enthusiastic about this tool. And we can work in this way in WHO with different programs, not only hearing aids. Next, please. Well, you maybe are wondering, well, what about cochlear implants? When is she going to talk about cochlear implants? Well, what is needed to start with cochlear implants? Well, the device itself is not really enough. We need, of course, member states to ask for technical support. We need screening programs. We need multidisciplinary teams for the assessment. We need, of course, the access to surgery and rehabilitation and follow-up. Next, please. We need to involve the civil society. Next, please. The politicians and policymakers, and of course, next, please, the industry. Next, please. So let's think a little about the hearing aid service delivery tool and think about the reality today with cochlear implants. Today, we have in the tertiary level all the services for cochlear implants. But Why not put at community level the assessment, the rehabilitation, and the follow-up? That could be a way to make more accessible hearing aids from the services point of view. And when I did this slide, next please, that remind me this one. So it's a very interesting aspect we can explore, but next please. We can't forget about this slide. We need to consider all the aspects, not just the services related to cochlear implants. Next, please. So I don't know which will be the right way to go to provide quality access to cochlear implant to all people that need the device. Doesn't matter where that person is in terms of country or region, but we need to start the discussion in some point. And I think CIICA is a very good place to start the discussion. Next, please. Thank you very much.